Hey, thanks for tuning into the channel and thanks for watching this video. Today I'm going to get right into understanding neurofeedback. What exactly is going on with neurofeedback here at Watson Psychological Health Center? My name is Ryan and I spend most of my days looking at these little squiggly lines going across the screen trying to figure out how we're going to help people. It's one of the most enjoyable things I do. A lot of people ask right off the bat, is this billable to insurance? I do not bill insurance for this. There are CPT codes that can bill neurofeedback, but I choose not to. There's a lot of issues that I don't want to get into with billing insurance for those issues. But just let it be known that at this point in time, now there's some things with ISNR coming up in the future where it might be a possibility for some diagnosis to be treated with neurofeedback. But at this time in 2022, that is not a possibility. So we hope that the research and the education and collaboration with the entities with insurance companies and things like that, we definitely hope that that continues and that, your insurance provider will definitely jump on board with this because it would open up the door for so many people. Because as I'm showing you this right now, what you're looking at is the change, the neuroplasticity, the normalization. Can the brain change itself? If you, Norman Deutsch, Deepak Chopra, these guys, when you're looking at neurocompensatory factorization and is the brain able to rewire itself? Because Norman Deutsch wrote the book, The Brain That Rewired Itself. In other words, saying, can we get better with time? There is plenty of evidence in his book and in numerous published articles that says yes. And so what's really cool here in the office, what we offer is a pre and post map. So when you come in and you choose to do neurofeedback, we may 90% of the time I do maps, pre-maps, so we're looking at what's going on where, what's happening, so that we can get structure and function. Now we're not looking at pathology or anything like that, just looking at what's going on where so we can get a pretty good idea of, hey, when we're training and we're dealing with emotional situations, where do we want to start to get the best bang for our buck, so to speak? And that's really important because I don't want to spend time training an area that doesn't need trained. Now, there are times you may ask, Ryan, do we have to do a map? Well, with kids, most of the times I choose to. It's just best practices. Sometimes with adults, they're a little bit better self-reporters and things of that nature, so we don't necessarily have to. And I have a few adults that I've done that with lately, with just all the things going on, because more and more people are dealing with increased levels of stress. So if you look at that from, just from a mineral perspective, basically saying, hey, when you look at sodium and potassium and the ratio of sodium and potassium, sodium is controlled by aldosterone. And that's key because that's basically with the adrenals, you're looking at fight or flight and a lot of stress levels, hormone levels, health, things like that. So as stress changes, there's a lot of chemical processes that are going to happen, which is going to have an impact on your potassium and your sodium, and we know that research has been proven that when that ratio is out of whack, you're going to have issues with pain. You're not going to be as clear. You're not going to have energy because it is considered the vitality ratio. And that's really important, guys. Now, don't go to the supplement and grab a bunch of potassium and a bunch of sodium because it doesn't work that way. You can't go take sodium and increase sodium, or there's buffers, and basically you have to learn this mineral will affect that mineral and this mineral will affect that mineral, so they all affect each other. And that's really important. You have to understand, because one of the things with the sodium potassium ion pumps, what we're looking at is with neuroplasticity, can nutrients get in and out of cells? Can the mitochondria be affected in a proper way? And that's really important. And so what I've learned here is this individual, we have a 34% change, or plasticity is occurring 34% of the brain and reorganizing. Guys, this is huge because when that happens, your normalization, you're going to move from those standard outliers on a bell curve, meaning 3, 2, 1 standard deviation out. You're moving more towards a norm, and that's really good because this is going to help behavior, it's going to help impulsivity, and it's going to help a lot of symptoms. So you may be thinking, well, Ryan, I don't deal with some of those, but that's okay, because this is just the example I'm going with. Because if you look at, I think you can see my cursor, but right now I'm looking at FP2. And with FP2, you're going to be looking at a little bit of, sometimes it's easy to get ruminations. You know, you're focused, you're worried about things, there's a lot of stuff going on in your life, and sometimes you feel powerless and a lack of control. And in some of those states and in some of those situations, we can act a little powerless at times. And a lot of times people have a problem with the word powerless. And in a substance abuse group, we were talking about powerlessness the other day and what powerless really means. Because from an AA perspective, step one is to admit that we become powerless. Now, if you think that sometimes powerless isn't an issue, just think about it from this perspective for a second. You know, in that group, everyone brought in a Coke. And so caffeine being the most abused substance in America, because caffeine is actually a mind-altering substance a little bit, it is a stimulant. And people don't realize that at times. But it's really important to keep that in the back of your mind, because that can have a huge effect on neuroplasticity. Now, it can also affect the sodium-potassium ranges. I don't want to get too far into some of this, because this gets great. It's great learning topics, and there's a lot of depth there, but it's a little too much for this video at this point in time. But anyway, so impulsivity, coming back to powerlessness, just try not drinking Cokes, or try changing something, and try taking a break from our good old cell phones, you know, the handy dandy. Well, I got a lot of nicknames for that, but I'm not going to use that in this video. So anyway, but guys, there you go. So there's a little bit of what we're looking to do. So can we guarantee these results with everyone all the time? No. Because there's a lot of factors for change. You know, do you have medical diagnosis? You know, has your doctor got you on medications, things like that, to help with that? Have you been treated for those things? You know, have you had good basic hygiene, things like that, health-wise, dietary functions, exercise, things like that. So there's a lot of factors that can affect that. But I wanted to come in and give you a quick video today on what is neurofeedback, kind of what we do here in the office a little bit, and how this is kind of different from your talk therapy modalities. In the trend screens towards the end of the sessions, I'll usually come back and talk about, you know, this microvolt range and what's happening with alpha. If alpha is at 20 microvolts, what's happening in the brain, because the brain's going to be ruminating, especially if I'm working posteriorly. If I see a bunch of alpha anteriorly in the front of the brain, that's a different topic. But in the posterior regions, we really want to talk about stress. You know, we really want to talk about that ruminating, things like that. When we're looking at T3 and T4 over here, we were really working on some of the emotional trauma of the past, because when we get stuck in our past trauma, feelings buried alive never die. We just think that, but a lot of times when I say we just think that, we think that we can just, time will fix things. Guys, unfortunately, time doesn't fix trauma. What it does is it brings it to the present. Every time you have a similar situation in that day, you're going to go back in time. And it may not be a conscious thought, it may be something that's more subconscious a little bit, but you're going to have all those feelings come back up. And if you really sit with yourself and pay attention to that, you'll experience that, you'll notice that. So the more in tune and aware you are of how you're feeling and what's creating the depth of those feelings, that's going to have a huge impact. So wanted to come in and talk about that. So we've been working on a little bit of emotional trauma and just working on clearing that. Did some EMDR and some other modalities to help with that as well. So it was really cool to see this. I was really excited. And of course, you know, the individual had some very positive reports about noticeable changes, and excited. So just wanted to come in and share some of the excitement with you guys. Hope you have a great day. And until next time, take care.